Hello, ladies and gentlemen. Today we are going to tell you about the immunological disease of lupus.
We will be trying different points about this important disease.
An illness autoimmune, the home immune system attack the cell and healthy fabric by error. This can damage a lot of parts of the body, including the articulation, skin, kidneys, hairs, horn, blood vessels, and the brain. There are several types of lupus. Systemic lupus erythematosus is the most common. It can affect many parts of the body. Discoid lupus causes a rash that does not go away. Subcutaneous lupus causes blistering after sun exposure. Drug-induced lupus, it is caused by certain medicines disappear when you stop taking the medicine. Neonatal lupus, not common and affect newborns. They can be caused by certain antibodies from the mother.
Lupus erythematosus remain unknown in the quest of autoimmune. This is there a variety factor that can cause lupus. The best known is the immune system whose functions is responsible for defending the body against possible infections. Other causes that are helpful respond to genetic. However, it is still not known which specific genes are responsible for the disease. Lupus can have many symptoms. The most common pain, joint pain or swelling, muscle pain, fever with not known cause, hair loss, and ulcers in the mouth. Symptoms may appear and disappear. These called outbreaks.
What does the patient usually experience? The symptoms of lupus often resemble those of other minor illnesses. For patients with this disease can evolve in periods where there are no symptoms present, which is called remission. How is diagnostic? There is no specific test to diagnose lupus. To get a diagnosis, your doctor should consider, among other things, your medical history, a field review, blood tests, skin biopsy, and kidney biopsy.
To prevent it. Although there is not a specific prevention measure to prevent lupus, such as a vaccination, a healthy lifestyle can help prevent the development of the disease or control its symptoms should it occur. Regular exercises help prevent weakness and fatigue of certain muscles. It's advisable to avoid negative habits such as tobacco and alcohol. Joining support groups or talking to friends, family, and doctors can help alleviate the stress effects of lupus.
Treatment or therapy. The treatment of the disease is not subject to a single therapy. It's very different according to the organ to which it affects. Corticosteroids are considered the basic treatment since everyone affected at one time or another needs them. If the damaged organs are the lung, heart, central nervous system, or kidney, the treatment must be much more aggressive and is based on corticosteroid in very high doses and complement with immunosuppressive treatments. Depending on individual characteristics, lupus patients are often advised to maximize protection against sun exposure, especially in those who have skin problems, to take precaution against infections, to be up to date with specific vaccinations, as well as special care during the pregnancy.
Cause injured in many areas of the body such as blood clots in veins on artery, destruction of red blood cells or anemia due to chronic disease, injury of the tissue of the lungs and fluid around them, swelling of blood vessels. A manifestation of the disease are aggravated or new one aped contact especially.
Prognosis. The prognosis of lupus is better today than ever before.
with close follow-up and treatment 18–19% of people with lupus can expect to live a normal lifespan. It is true that medical science has not yet developed a method for curing lupus, and some people do die from the disease. However, for the majority of people living with the disease today, it will not be fatal.
Thank you for your attention. We hope this information helps you to know more about this disease.